complete.
رابح منصور.
Rabih Mansour from Fujifilm. Okay.
Okay. Assalamu alaikum. This is Rabih Mansour, application specialist at Fujifilm, Middle East and Africa. Today I'm going to present the Fujifilm Open MRI, where innovation meets the patient care excellence. And we will provide the solution of the patient comfortability and supporting the patient which is have claustrophobia. So this is our portfolio for the whole portfolio for CT, MRI, back systems, 3D system, and the endoscopy. For open MRI system, a lot of patients have different challenges. We are facing a lot of challenges, which is clinical outcome, user, operator, and the patient challenges. We are facing the challenges with the throughput and the environment and the return of investment. All of this can be supported and can be handled by the innovation and technology, which is supporting the human needs exactly and getting and leads to the patient comfortability. So Fujifilm implemented different solutions to come over a lot of challenges, which is the safety, the patient pain, and the claustrophobic patient, the movement, a lot of challenges we are facing especially for the patients and the procedures in CT and MRI. So, for example, this is the result of the AI technology, which is improved and getting the image quality after using the AI. Before this data, the raw data of this is the raw data of before using the AI. You're able to see the image quality improvement after applying the AI and getting the much better image quality for movement, especially for MRI, shoulder images, and the abdomen images. In regard of the open MRI system, we have different system for open and closed system. We have the low field MRI and high field MRI. The low field MRI, including the open MRI magnet, permanent magnet, and superconductive magnet. The superconductive magnet is the one of the 1.2 Tesla, one of the USP for the Fujifilm, which is covering the basic and advanced procedures, which is equal to 1.5 Tesla. I will start by presenting the hypertelucent machine, which is low field MRI. The low field MRI, it's always it's an open system, and the patient comfortability. This is the aim of using this machine, and the patient is always in comfortable space, and we able to use the different position according to the patient comfortability, according to the patient position. We don't have any problems with the patient position. In addition of that, the open MRI system can be installed with a very narrow, very small area. So the open MRI system have a lot of benefits, and for sure, a low field MRI, it's not cover the high advanced exams like cardiac, like the advanced exam, like the dynamic prostate, like this. But the other things, which is musculoskeletal and the musculoskeletal, including the abdomen images and the neuro images, it's be covered, and we able to use the 0.4 images, 0.4 Tesla to get the high SNR because of our technology, which is high order shim. The high order shim increasing the shimming of the machine, and this leads to high image quality, especially for open MRI. So the image of the open MRI, as you see it here now, with the scan time with the 15 minutes, you're able to see the high image quality with the brain images with the stroke protocol, including 3D images. So as the cervical images, as you see it here, the high image quality, thanks to the high order shim technology and the AI technology to improve the image quality and removing the noise. Even with the reducing the scan time, we're able to get the highest image quality using the AI technology. So this is the example for lumbar spine images, which is showing the good anatomy and leads to diagnosis images. So the fat suppression images for the musculoskeletal, the shoulder images with the apertuluscent with the fat suppression, and end of the day, we able to use the old position, especially for shoulder and the lateral organs. We able to use the open MRI more comfortable for the operator and more comfortable for the patient, especially for the ligament, shoulder, elbow, humerus, forearm, and wrist and hand. So the advantage of and the capability of the open MRI system, that the RF fat suppression, which is using the high order sham technology, which is dedicated for Fujifilm. So here we have the non-contrast exam, which is using the ASL technique, arterial spill labeling technique. We're able to get the high image quality for the vascular images, renal artery, carotid artery, and the lower limb angiography using the ASL technique without contrast. So in addition of that, the radar images, which is removing the motion artifact for the patient who have motion. As you see it in the shoulder, we're able to get the best image quality. Advanced images, we're able to cover the musculoskeletal, we're able to cover the most of the basic and advanced exam, excluding cardiac and dynamic images for the breast and the prostate. So one of the most advantage in the apertuluscent or low field MRI is the artifact reduction. Artifact reduction in our system is using the AI to remove the cost reduction as well as the artifact reduction, which is come with the diffusion image. So in fat suppression also as well, the low field MRI have a big problem regarding the differentiate between the water signal and the fat signal. So here, the narrowing area between the water and the fat is detecting by our system by the high order sham and getting the best image quality for fat suppression. So in addition of that, the technology of radar, which is using for any motion artifact, especially for respiratory artifact and the radial artifact and the moving artifact for shoulder and the ligaments. This is arterial spill labeling with the high signal, especially for the carotid angiography and the most of the small FOV. Here we are able to use in the conventional MRI, we're able to get the images with the 25 minutes. Here we're able to reduce the time to 15 minutes only, including MRA, the for strict protocol. So, and the iRapid, this is the technology of the AI, which is using to accelerate the scan time. In addition of that, we have the multiple coils, which can be used for multiple purpose and the multiple organs and cover the whole body part. In addition of that, we're able to use the multiple coil in addition to get the state change imaging and for the conventional imaging for spine, whole body imaging like that. So coming to the advantage of this is the real cases which is done for the cerebral angiography, cerebral cases. This is another case which is the 3D images for the neuro images. Another case which is the MRA diffusion with coronal images. As you fully aware about the diffusion image, it's very sensitive to the plane and the artifact. Here, our system is applying the deep learning technique to remove the image, the noise, and getting the best image quality, especially for the metal artifact reduction and the acoustic reduction, and also as well is any artifact regarding the diffusion image. So, and this is the one case of the cerebral infarction. Another case, or another type of diffusion, which is using the axial and the coronal for the same case. 3D images, vascular images, MRA and MRV, vertebral artery, and here this is the 3D myelography, which is presented the 3D for the cervical spine. In addition of that, we able to get the diffusion for the cervical spine because of the high shimming and getting the best image quality after deep learning technique. Coming to the post-contrast exam, which is using the fat suppression, we're able to see the full anatomy, and after the contrast, the fat suppression is ideal. So here we able to see the radial images, which is getting the shoulder with the full anatomy in different direction. In the fat separation images for the peripheral area and the extremities area, this is it's very challenges because of the air and the position of the coil. We're able to get these images with the high image quality because of the shimming and strong shim. So coming to the larger FOV and the musculoskeletal for the foot and the tibia. So the fat separation, it's applied very well and you're getting the most good image quality with anatomy. So in regard of the most challenges, which is the small FOV for the open MRI. Open MRI, if we change the slice thickness and change the FOV, we're able to get the multiple artifact, and this is affecting on the image quality. Here, we're able to avoid all of these challenges, and we're able to overcome these challenges by using the technology of IB Rapid, IB Recon, IB Slices, with deep learning technique, and getting the best image quality within small FOV for prostate. Coming to the dynamic diffusion images, as you're able to see the diffusion and the AC without any artifact, and you're able to get the good image quality for the pelvis and the the MRCP and the MRU. For MRCP and MRU, we're able to use a single shot and the 3D images. We're able to get the highest image quality depending on the shimming. Shimming is controlling the image quality for open MRI and increasing the quality of the images, as especially for a small FOV and a large FOV. For dynamic, for liver, depending on the scan time, and able to get the liver trivesic. So here, this is the vascular images using the ASCL technique for lower limb angiography and renal artery. So the breast image and the whole body images, we're using stitching. Even with open MRI, we're able to use the AI to able to stitch the multiple region in different area for the whole body, whole spine, as for example. So using the AI, the AI make the life easier, and the innovation is supporting the human needs, especially for the patient who have a lot of problems and they have claustrophobic. So this is the summary of the open MRI percutaneous machine. So coming to the one, we have another machine which is the advanced machine, 1.2 Tesla. What's different between 0.4 and 1.2 Tesla? The 1.2 Tesla is covering the whole workflow. Depending on the 1.2 Tesla, we're able to cover cardiac images, and the obese patient, pediatric patient, we're able to cover the whole workflow for clinical images as well as all images. So here the techniques of we're able to see the mother and the daughter sitting on the table, and we're able to see the full open area with the comfortability of the patient. We're able to use the ring coil and getting the best image quality. So in addition of that, we have the big, this is a 250 millimeter open, as an open area, and this machine covered the all advanced exams and getting the bilateral cases. More than 400 kilogram can use it, and we're able to use it with the high order shim. We're able to use it as a 1.5 Tesla with the very good image quality. Here we're able to use the extremities, and the table itself is 85 centimeter, and we have a lateral movement right and the left side, which is giving more space to apply to get the all techniques for peripheral area. In addition of that, pediatric sequence, acceleration scan time. In addition of that, the old age, and getting the one of the best coils, which is air coils, which is using for the extremities, can be tied of according to each organ. In addition of that, we have the patient comfortability can be used in the lateral position, in a different position. Any position we can be used in this 1.5 Tesla because of the strength of magnet and getting any position for kyphosis cases, scoliosis cases, and we're able to get all coils with this machine. In addition of that, the built-in coils and the multiple coil selection, multiple coil, whole body imaging, diffusion, and the all isotropic imaging, and the accessories also as well. Coming to the capability of this system is capable to do the all body exams, including cardiac, including the angiography exams, including the T1, T2 map for the cardiac imaging. So, end of the day, I want to finalize my presentation. OpenMRI is using the innovation to support the human needs, and they make the life easier for the operator, make the life easier for the owner, make the life easier for the patient. Thank you so much. Any question? Yes, please. Yes, both machines have the three type of monitor. Both machines